A dental crown is basically used to cover a severely broken down or decayed tooth, or a tooth that's just developed cracks in it. And so a cracked tooth can be lost prematurely in a very young person if that crack is allowed to proceed below the gum line or into the pulp of the tooth where the nerve and blood supply are. And so I tell patients what a crown is a crown basically acts like a hoop around a barrel. That hoop on a barrel holds all the staves of that barrel together so they can't spread apart. And so when we place a dental crown on a tooth, that crown allows the patient, when they're chewing and when they're in function or when they're smiling, keep that tooth together in one piece so that the crack doesn't propagate further. Same for a tooth that's badly decayed. You can imagine that we need a lot of tooth structure to hold filling material in a tooth for many, many years, because all that chewing force is working to spread that tooth apart. And when we place a crown over top of that tooth, it gives the patient one mass of tooth to bite on that then can't separate. Strengthens the tooth quite a bit. There are also many cases where we use crowns to correct worn teeth. And so in patients that may be severe grinders or clenchers, or have occupational exposure to abrasives such as farmers that spend all day in an open cab, where the dust is constantly coming between their teeth every time they close, many times we'll have to do a full mouth of crowns to restore that patient back to the proper length of tooth so that when they smile, they show and display the right amount of tooth, as well as restore the tops of the teeth so that when they're chewing, they have maximum chewing function.